Welcome to the Andago education video. Andago is the latest in overground robotic gait training, and in this video, I'll be showing you how to use it. Before using Andago, make sure to read the user manual and check the indications and contraindications. Andago is a mobile robot for bodyweight supported gait training that will allow a safe and functional training environment for upright, hands-free walking without being limited by space. It bridges the gap between treadmill-based gait training and free walking. The Andago features a passive frame, 4 caster wheels and 2 drive wheels, 2 bodyweight support units, 2 suspension carriers, and a handheld control. An Andago therapy session can be divided into 4 different phases: prepare the patient and the Andago, set up the patient, training, and bring the patient out of Andago. In this video, we will guide you through the 4 different stages to show you how to use Andago with your patients. Prepare the patient and the Andago. Turn on Andago. Select orthopedic material. Place the harness on the patient. Turn on Andago. Press the power button located on the bottom of the frame above the right rear caster wheel, and Andago will be ready to use. After the Andago boots up, you can check the patient ID on the display. Remember to check the contraindications before starting an Andago session. For contraindications and risk factors, please refer to the user manual. Select orthopedic material. Andago comes with 2 different leg interfaces to improve adaptability to each patient. For patients who require high levels of bodyweight support or who need to be set up while sitting or lying down, we recommend the leg straps. For patients who are able to stand up during setup and require low body weight support, you can increase comfort by selecting the leg loops. Place the harness on the patient. You can place the harness on the patient while he is sitting, standing, or lying down. In this video, we will show you how to place the harness on a patient in a wheelchair. First, ask the patient to move forward in the wheelchair. Ensure trunk stability during this step. Wrap the harness around the trunk as low as possible, covering the iliac crests. Check the lateral alignment by looking at the tag on the back of the harness. This should be aligned with the spine. Proceed to close the harness. Buckle and tighten the 3 straps as much as possible without limiting patient breathing or digestion. Be careful with catheters or stomas, as they may be present in some cases and require special attention while placing and tightening the harness. Lastly, connect the leg straps. Tilt the patient to one side and place the strap over the ischium. Then, connect it to the anterior buckle identified with an orange line. Tighten it from the front and back and ensure there are no wrinkles in the strap. Loose leg straps will allow the harness to travel upwards when the patient is lifted. Set up the patient. Place patient in Andago. Lift the patient. Adjust bodyweight support. Adjust fall limit. Place patient in Andago. Andago enables easy setup for patients in wheelchairs. Push your patient into the Andago and position the shoulders under the suspension carrier. To facilitate sit to stand, place both feet of the patient on the floor. If you have handrails, the patient may use them to support and stabilize himself during sit to stand. You may need to adjust the height of the handrails or remove them according to your therapy goal. Lift the patient. After the patient is properly positioned, connect the suspension straps to the buckles on the harness. Use the lower buckle by default. Use the protectors to cover the unused buckles. Lift the patient by using the handheld control until the patient is in a suitable standing position. Adjust bodyweight support. Body weight support is the amount of unloading the Andago will provide your patient. There are two body weight support units, and the total amount of unloading is the sum of the two. Andago allows you to provide symmetric or asymmetric body weight support to your patient according to his needs. Symmetric body weight support is selected by default. Simply increase or decrease the amount of body weight support and it will be applied on both sides equally. Remember, the total amount is the sum of both sides. In order to provide asymmetric body weight support, select the right or left body weight support button according to the side you want to unload, and increase unloading to the desired level. Then repeat for the other side. With this option, you can adjust independent unloading values for the right and left side. Adjust fall limit. Andago is a versatile medical device. For example, you can easily integrate it into your therapy sessions to have the patient perform balance exercises on an unstable surface or to train weight shifting with controlled loading. To do so, ensure the fall limit has been properly adjusted. The fall limit controls the amount of vertical displacement before the patient reaches the safety limits of Andago. You can identify the fall limit by looking at the distance between the arrow on the suspension carrier and the mechanical limit indicators. By pressing and holding the default fall limit button, your patient is able to walk on flat surfaces and able to step over or onto 13 centimeter tall obstacles. You can increase or decrease the vertical displacement by moving the suspension carrier up or down. If you move the carrier up, you will increase the upward vertical displacement, and your patient will be able to step over or onto taller obstacles. If you move the carrier down, you will increase the amount of downward displacement, and your patient will be able to do bending exercises like squats or balance exercises. Use the lift button to adjust the carrier height. When your patient reaches the mechanical limits as indicated by the orange lines, Andago will display an error message. Use these lines as a reference to see how much displacement you are providing to your patient. Training. Select training mode. Select speed limit. Start session. Turning offset if necessary. Select training mode. Andago provides you with 3 training modes: patient following mode, straight line mode, and manual mode. Patient following mode allows the patient to walk freely with the Andago, sensing and following his movements. Straight line mode will make the Andago follow a straight trajectory despite any turning inputs given by the patient. Manual mode allows the therapist to manually guide the Andago with the joystick on the handheld control. You can always take control of the Andago by pressing the override button and moving the joystick to correct the patient's trajectory during a session. This feature works when it is in patient following or straight line mode. Select speed limit. Andago will always follow the patient according to the speed at which the patient is walking. However, a speed limit can be set in order to improve the steering of the device and safety. There are 3 speed limits: low, medium, and high. Select the speed limit that matches best with your patient's walking speed. While walking, if the suspension sliders are at the forward limit of the suspension carrier, select a higher speed limit. Start session. Now you are ready to begin the training session with the Andago. Press the start button to begin. Press the same button at any time to pause and restart. Turning offset. The turning offset is a feature that will facilitate straight walking in patients who tend toward trunk or pelvis rotation during gait. Trunk or pelvis rotation will naturally turn the Andago, and the turning offset will compensate for this. To set the turning offset, look at the Andago while your patient is walking. If, while your patient is trying to walk straight, the Andago is slowly turning to the right, correct it by pushing the left turning offset button. Vice versa if the patient naturally steers the Andago to the left. There are 4 levels of correction on each side to adjust to all patient asymmetries. Please check the indicators in the handheld or the Andago display to check the current turning offset value. Before correcting the turning offset, ensure proper harness placement. Check that the tag of the harness is lined up with the patient's spine. Bring the patient out of the Andago. Stop Andago. Press the reset button and save patient information. Lower the patient. Unclip patient from Andago. Stop Andago. After training, proceed to finish the session. To finish the session, press the Start Pause button on the handheld to stop the Andago. Press the reset button and save patient information. Remember to note the session ID in your notebook in order to monitor patient progress. Information on session time and distance will be shown in the display along with the session ID. Push and hold the reset button for 2 seconds to bring all parameters to their default values. This will also save all the session information. Once the session information is saved, the ID number on the display will increase and the rest of the information will reset to 0. The information is saved on the Andago USB stick. Lower the patient. Bring the wheelchair to the patient. Lower the patient via the handheld control until he is sitting down in the chair or wheelchair. Lower the handrails if they prevent the body weight support units from moving down. Unclip patient from Andago. Now open the 4 buckles to release the patient from the Andago. For safety reasons, they cannot be released if there is tension on the strap. Ensure the suspension straps are loose to release them. Open the 3 front straps of the harness. Then, open the leg interface by unclipping the front buckles or opening the thigh velcro according to the type of interface selected. And pull up slowly. You can now bring the patient out of the Andago. We will now go over all of the safety mechanisms of the Andago version 2.0. Stumbling detection, collision sensors, emergency stop pull cord, emergency stop button, ramps or inclined surfaces, error messages, and brake behavior. Stumbling detection. The Andago detects when the patient stumbles by identifying when the patient reaches the lower mechanical limit of the suspension carrier in relation to the body weight support unit. Andago will immediately stop. To restart the session, ensure the patient is in a proper position and press the start button on the handheld. Collision sensors. Andago is equipped with collision sensors in the black bumpers of the device. If there is a collision, the Andago will inform you with an audio signal and will not move in the direction of the collision. The patient is free to move in any other direction. Emergency stop pull cord. The Andago will always follow the patient's movements, and that includes stopping when the patient does. However, if for any reason the patient wants to stop, the Andago is also equipped with an emergency stop pull cord. Ensure the cord is placed in a reachable area and explain the mechanism to the patient to maximize safety. Emergency stop button. There is a second emergency stop mechanism designed for the therapist. Training can be interrupted at any time by simply pushing one of the emergency stop buttons located on either of the body weight support units. To restart the session, ensure your patient is standing in a proper position and can continue training. Then release the emergency stop button and push the start button on the handheld control. Ramps or inclined surfaces. Andago is intended to be used on flat surfaces. Training on ramps or inclined surfaces is not allowed. However, You can manually steer the device on ramps without a patient in some cases. Read the user manual carefully in case this warning appears on your device. For inclines steeper than 10 degrees, the Andago can only be pushed without a patient in passive mode while it is switched off away from the incline. Error messages. When this icon appears on the display, the Andago has sensed a technical issue. Turn Andago off and back on to see if this resolves the problem. If the error persists, contact your service technician or our service desk at service@hocoma.com and reference the error code shown on the display. Brake behavior. The brakes on the 4 caster wheels on the Andago are automatic and engage and disengage according to the mode the Andago is in. If you want to move the Andago around the clinic while it is off, you might need to disengage the brakes manually. To do so, move the 4 brakes to the middle position. We hope this video has helped you understand how to use the Andago. For further information, please consult the user manual. For any technical issues, contact us at service@hocoma.com. And for any other issues or feedback, contact us at clinical.applications@hocoma.com.